right, just about 5 minutes after 11 o'clock. Thank you for tuning in. Really not a bad-looking day out there, is it, Robin? Looks pretty nice.
No, it's gorgeous.
Amy Hennessey is on the phone. Amy is the Senior Advisor for the Consortium for Medicaid and Children's Health Operations at the Centers for Medicare and Medicaid Services. She's talking about healthcare coverage for children as well as teens and adults through Medicaid and the Children's Health Insurance Program, also known as CHIP. By the way, I remember when my son was little, I had a program called the Kid Care, the Kid Care program?
Yes.
I think it was. Oh, my gosh. It was a lifesaver because, thank God Alex never really got sick. But, I really couldn't afford insurance back in those days when he was little. He's going to be 32, believe it or not. Seems like yesterday, but it's a long time ago. Amy Hennessey. Good morning, Amy. How you doing?
Good morning. I'm great. Thanks so much for having me today.
Where are you?
I'm sitting out of Chicago.
Okay, I thought I lost you there for a second. How's the weather in Chicago today?
Not as nice as Florida, let me tell you. We had snow last night.
The Chamber of Commerce thanks you for that answer. We want people to come down here. So yeah, when my son is 32, but when he was little, I remember this was like, oh my gosh, how are we going to afford insurance? And there it was, the government had something, and I'm not a big government guy. I kind of stay away from it if I can, but this was one of those times where I said, thank God for the programs that were made available, especially for health insurance for my son.
Yes, indeed. And so you referenced Florida Kid Care, and today I just wanted to talk a little bit about Florida Kid Care as well as the Medicaid program. They both offer free and low-cost health coverage for kids and teenagers. And I think your listening audience might be eager to know that in most states, including Florida, children and teens and families earning up to $50,000 a year may qualify for the programs. So we often hear from people, they'll say, Amy, this is great, but I know we won't qualify. We make too much money. We really encourage people to go and apply because the income thresholds are higher than people realize.
Yeah, I didn't realize that either. 50,000. Wow. That may not sound like a lot to somebody up in Chicago, but here in Central Florida, that's a pretty good salary.
It is, and in some states it's even higher. So we just wanted to talk a little bit today about the program, let people know that it's out there. We know that in Florida alone there are about 230 uninsured children, and so we'd really like to see that number come down. So if any of your listeners have kids that don't currently have insurance or they know kids who are uninsured, we really encourage them to apply, and they can do that in two ways. One is to call a phone number, 1-877-KIDS-NOW. That's 1-877-KIDS-NOW. Or they can go online to insurekidsnow.gov.
And is a child considered anybody 17 and younger?
It's actually a little older than that. So these programs cover kids all the way up through 19, and in some instances up to 21 even. So it's definitely, the cute little babies and toddlers all the way through the teenage and even college-age kids.
Is there a gap? Is there what do they call when somebody falls through the cracks? They make too much money for this, but not enough money for that. Is there a situation like that you can address?
Sure. So the two programs differ. The Medicaid program and Florida Kid Care differ in income eligibility. And so typically families that make too much money to qualify for the Medicaid program will then be eligible for Florida Kid Care. Okay. And the good news is families can apply for both in the same way. So they can call the number or go online and they'll get put in the right program.
Amy, real quick, I just want to offer an apology. It sounds like the technical end of this is giving us a little bit of a delay, and it sounds like I'm talking over you, and I don't mean to be doing that. I apologize if I did that a couple of times. So the website, insurekidsnow.gov, is where we would start. What would we need to know before we sit down at the computer? Do we need any information from a doctor, or do we just need the social security number of the child? What do we need?
Great question. So when you go online to insurekidsnow.gov, you would simply need basic information, name, address, how many children you have, the number of children in your household, their names, and then estimated income. And then at that point, at the state level, state of Florida will run through their systems to confirm eligibility. So it is quite easy and pretty quick to apply.
And are there issues regarding let's say we have a favorite doctor or a favorite pediatrician in this case, are there regulations that might prevent us from going to the doctor we prefer?
So just like any other health insurance, there are certain doctors that participate in the programs. And when a family is enrolled and they receive their eligibility packet in the mail that says, welcome to the program, here's your card, etc., they'll be given a list of doctors that participate in the program. And so they'll have to choose among those different providers.
We just before we had a doctor on, and I probably wouldn't have even thought of this question except for the previous guest. She was a psychologist and a psychiatrist, I think both. Mm-hmm. Adolescent psychologist and child psychiatrist, I think. But anyway, the point is, does the health insurance we're talking about cover, I guess, psychological illnesses? I don't know if I'm asking it right.
It sure does, and you are asking it correctly, and that's one of the great benefits of both of these insurance programs, both Florida Kid Care and Medicaid, is that the coverage is very comprehensive. So as you mentioned, it does cover mental health services as well as sort of basic kid health coverage, things like immunizations, physicals. Additionally, the programs cover both eye and dental exams, which are really significant for families. Prescription drugs are covered, as well as trips to the emergency room, which we know kids are kids, and especially with summer coming up, sometimes there are injuries, and of course hospital stays. So the coverage is actually quite comprehensive.
Wow, that's really good to know. So is there? Let's say you go to insurekidsnow.gov. Do we have a way to ask questions? Like, let's say we're there and something isn't clear. Is there a chat box on there where we could talk to somebody or type with somebody or call? Oh, I guess the phone number would do it, huh?
That's exactly right. 1-877-KIDS-NOW. That'll take care of it, and folks would be connected to someone who can answer all of their questions.
And the word Medicaid used to have a stigma about it, but it doesn't mean the same now as it did all those years ago. So people shouldn't be embarrassed to have Medicaid assistance programs.
No, not at all. And as we talked about earlier, the income threshold for these programs are pretty high, and so people should not at all feel badly about not having insurance. At the end of the day, we just want to get those 230,000 kids in Florida who don't have insurance, get them covered so that they can stay healthy and active, do well in school, play soccer during the summer, climb a tree, and not worrying about, breaking an arm and what the financial impact of that would be on a family. So really, we just want these kids to get covered, and people should apply if they have uninsured kids.
And there should be some kind of tax credit for the parents then at the end of the year.
I'm not quite sure about a tax credit for applying, but certainly, there are requirements about having insurance, and so this would help in that regard.
Does it cover the visit to the doctor, I guess, to prepare for the school year? Let's say that your child's not sick, no symptoms, nothing. You just want to. I guess you got to get the checkups every year. I think that's a rule.
Wellness exam,
isn't it?
Yeah.
Does it cover that?
Yes, it sure does. The wellness exams are covered, as well as immunizations and other things that kids might need for school. So, for example, perhaps an eye exam before certain grades. So, yes, the coverage is comprehensive, and wellness exams are absolutely covered.
Can I squeeze in one more, or do you have to run? I have one more question.
Please.
The person who is the foster parent, so the child living with them, let's say they've got 3 of their own children and they're a foster parent. They got one other child. Is that other child able to be covered? Let's say there's not biologically, they're not even legally their child, but they live with them.
Yes, foster care kids are covered under this program. So a child who is in the care of a foster family is eligible for the Medicaid and CHIP program and would receive coverage.
Oh, wow. It sounds like a really good program. I know it was a really good one. I mean, 30 28 years ago, whatever it was. It was such a good one. I'm glad to hear that it's still there. Actually, it sounds like it's improved since then. So I don't think we had eye care back then.
No.
I don't think so.
Dental, though.
Or dental, yeah. Amy, thank you for taking your time to talk to us today. That's really good information.
It's my pleasure. Thanks so much for having me.
You're welcome. We'll be right back.
Shamrock Security Systems, 629-3223. Shamrock Security Systems is located here in Ocala, Florida. Shamrock Security Systems is a top-rated alarm company offering 24/7 monitoring, video surveillance, fire and flood protection. You'll sleep a little better once the job is done.